My name is Robert Guida. I'm a facial plastic surgeon in New York City. I specialize in rhinoplasty surgery, revision rhinoplasty, as well as functional nasal surgery. I grew up in southwestern Pennsylvania, near Pittsburgh, Pennsylvania. I grew up in a very close-knit family, and music was very important in our household. Piano is a lot like surgery. When you're given a new piece, it looks unsurmountable. And I found out with practice, you master the piece, and then technically it becomes something that you can do. But then if you practice a little more, it's more than technical, it becomes music, and it becomes something very beautiful. And I've seen that can happen also in surgery. When I perform a rhinoplasty, it takes me 90 minutes, maybe 2 hours. I do it all myself. And I don't stop the operation until the result is the way I want it. I don't run an assembly line type of operation. We don't do cookie cutter rhinoplasties. Every one is individualized and customized based on the patient's anatomy. I've learned over the years, because I've been in practice for over 20 years, that rhinoplasty operation requires a surgeon that's very skilled in nasal surgery. And I think what also helps is caring about the patient. There are very good rhinoplasty surgeons that can technically perform the operation. You need another component. I think it's the level of how much you care about the patient and how much you want them to get the best result possible.
Have you ever had any trauma to the nose?
Yeah, when a patient comes to me for nasal surgery, I have to decide what really bothers the patient, and I try to get into their head to exactly what is the problem. Everyone has different facial and nasal anatomy, and everyone wants something different. I have to take all of that into account. So usually we start out with open-ended questions, because something that I may see as a problem doesn't bother the patient. And then I take digital images and download it onto the computer, and then we can use a morphing software to change the shape of the nose in real time on the computer. And it enables me to communicate better with the patient, seeing their own photograph, and then I give them realistic expectations whether it can or cannot be accomplished with surgery. Over the last 20, 25 years since I've been doing a lot of rhinoplasty surgery, I've seen a lot of extreme cases, and I've done a fair amount of revision surgery. And I've become obsessed with performing the perfect rhinoplasty procedure, because it can ruin someone's life if the nose, the center of your face, is off-center or actually very disfigured. And I think patients should know that they don't have to live with a deformed nose after a rhinoplasty, that it can be revised. Rhinoplasty surgery is an extremely technical skill, but it also takes a sense of nuance and an appreciation of beauty. But once the techniques have been fully mastered, I think rhinoplasty surgery can become an art.